Great. Well, welcome everyone to this month's Voice AI Summer School webinar. The purpose of these webinars is to both just provide some general education overview about the Voice AI project and some of the other AI issues related to it. And then a second purpose of this series is for the students who will be attending the 4 sites of the Voice AI project this summer as part of the summer school. So I will briefly introduce my colleague here at OHSU, Dr. David Dorr, who I've known a long time since he was a resident in internal medicine here at Oregon Health and Science University, and then he went off and did an informatics fellowship at the University of Utah, and then we recruited him back as an assistant professor a while ago. He's had an illustrious career in clinical informatics, and he also has continued to do some clinical work, which informs his informatics work. And he's now risen to the ranks of, he's a professor, he's the vice chair for research in our Department of Medical Informatics and Clinical Epidemiology, and he also serves as OHSU's Chief Research Information Officer. And he has a bunch of other accolades, which you can find if you ever come across his website or anything. I will let him go ahead and get started. He's going to talk to us today about how to be fair and care in AI. David.
Thank you. I appreciate that introduction, Bill. Yes, we've known each other for 25 years, so that's been wonderful. I'm going to share my screen. Hopefully people can see it. Yes. So as Bill mentioned, I'm an internist and an informatician, and most of my early research work has been in a program called Care Management Plus, which intends to use data, information, and knowledge to improve the health and well-being of vulnerable populations. And through that work and through our Bridge to AI efforts, where we lead the skills and workforce development component, we really have been interested in understanding how to share research, models, data in order to expand its reach and capability to improve human health, but also how to think about vulnerable populations or populations that may have faced historical and current discrimination systemically. And these 2 concepts are embedded in this webinar. FAIR and CARE are acronyms that I'll go into, and CARE especially, I think, is a useful one when we think about artificial intelligence and its complexity and its propensity for bias and worsening inequities. And I do want to start this by giving an acknowledgement that CARE came from the indigenous communities. It's actually a synthesis of many values and wisdom from indigenous communities, and I want to really highlight it is with humility and sort of recognition in my role as somebody who comes from historical colonists that I benefit from that wisdom. I seek to understand it, and I appreciate that those groups really inhabited the current land in which I am sitting, as well as much of the lands. And so this is an attempt to really recognize that as best I can, and to bring that work to your attention. So this is sponsored by the NIH Bridge to AI program, and our co-PIs are there, and I'm, as I mentioned, one of the team leads here, and that's the primary disclosure for this. So being fair and caring, what does that stand for? Well, FAIR as an acronym is about sharing research in order to address a number of problems with research, and AI can exacerbate those problems. And so FAIR stands for, can we make our products of research including the data, but also models, in this case, findable, so people can search for it and find it, accessible, so people could use it to understand its results, to expand on them, to reproduce them, interoperable, so it's easier to incorporate into future studies, and reusable, that it meets certain standards, so it can be reused. And then care, which comes from the several papers that synthesize efforts to understand what are the implications of this kind of data collection and sharing and research for Indigenous communities. And the Global Indigenous Data Alliance created this particular figure and really represents one major group that works on this. And CARE is synthesized from many of the values and documentation from Indigenous communities, then stands for a set of concepts about what is a good collaboration for research involving those communities, especially AI, which is that there's collective benefit, there's authority to control how that's shared, and there's responsibility on the part of the researcher, and also within the communities that's clearly laid out. And then there's specific ethical concerns that I'll go into. So FAIR is, as I mentioned, an idea that in order to improve the impact of research and its reliability, we think about how we make things findable in terms of getting them, how we can help people access data, and then how we can work with data and models to enable many people to learn from and expand on this research, and to really harden it for future uses, especially important in AI. Why is this important? Well, there is significant concern about the reproducibility of research, that even just trying to reproduce what a group of researchers did is very difficult in our standard publication process. There's a lot of the core protocols and information that still remain behind closed doors. And so in this Nature article, they're really looking at asking people, what is the nature of this problem? And so in this, the vast majority highlighted that there was a significant crisis, and that was for lots of different reasons, a number of which here are related to you just can't access how they did this, and that leads to problems. Absent any sort of an ill intention, that leads problems to for us all to learn together. The second thing is sharing techniques and data also allows us to answer questions we could never answer before. And so one of my favorite examples here is called Odyssey, which this map is from a couple years ago, the collaborators of a large federated group that maps their data to a particular data model, and then applies federated techniques to do observational studies on millions and millions of patients to understand, to gain new insights about certain health conditions in a way that would be very difficult to do if we tried to do serial clinical trials, for instance. And so finding ways to create interoperable and reusable data models, software, really enables a new kind of analysis that couldn't be done before and can potentially accelerate discovery. So how do we think about this for data, especially with AI? And, I think for each of these, AI has a specific set of issues that are important. One is that AI is often federated, so it's in multiple different places, that the models themselves evolve over time. They're often large computational models, not always, but they they have new characteristics that need to be kept. So when we think about trying to find data and models related to AI so they can use them, in some ways this has become more easy or easier in certain regards, because a lot of the open source AI, generative AI models are accessible, or there's large repositories of certain kind of models. But what we don't know is enough about the models, how they were developed, what they were developed on, so that you not only can find them, but understand, are they right for you? And we call storing that kind of information with an identifier and a place for the model to live that's called the metadata about the model, or the data itself that might be used to generate the model. And then for accessibility, this is part of our goal in the Bridge to AI program. It's actually to generate more accessible data that is created in a certain way. And this has been challenging, because you can't make every model or every set of data available necessarily broadly. There's still requirements. And for us with voice, this is particularly tricky, because voice is a kind of identifier. And so while we want to make it accessible so people know how to access it, we really have to think through that. And then interoperability is another concept where the data is stored in a certain way, or the model, it's the techniques of the model and the code are created in a way that other people can understand the feature selection, each of the developmental steps, and then it can be reused. And so this is those are sort of related in a way, in that you might, for interoperability, there's certain kind of terminologies and ways you exchange models or data, but there's still some gaps there. In reusability, we really want how that model was developed, what was it developed on, so we can understand what we need to do to reproduce the model, or even expand on it. What is it potentially good for overall? So really, for findability, we're really thinking about one, that you've registered it somewhere, you've saved it somewhere, and there's lots of different ways to do this, including publishing it with a publication of different kinds, storing it in a repository with a way to generate a standard identifier, but also what is in it. And that's what metadata helps with. And there's lots of different kinds of metadata. It can describe it. You can tell people what is in there. You can tell people how it can be used. And you can also do these with models. You can store them in a variety of repositories that then allow you to link people to them. And this is really what we want to encourage as we move forward. And so just some examples of data repositories, data sites one here. You're searching through the metadata for these different resources. You can store lots of different kinds of resources in these repositories. In this case, the example is dementia, and you can find lots of different kinds of resources here, not just data, but resources that include data. And then Figshare is another example, with a very simple example where you can see different data sets here, and the search term generates this. Now, one of the good things about metadata is you do want to use standards, so that, for instance, you could create machine versions of these kinds of searches and search many repositories and be increasingly specific in what you're looking for. So that's one thing that people want to do. And one of the big changes in this recently is that for findability, there's really an increasing expectation for all kinds of research, but especially NIH-funded research, is that you think about this. You think about sharing your data, how you manage it and you share, so it's going to meet FAIR criteria, and that's a good model when you're creating those kinds of plans to think through. The problems is, and that provides some incentive, but in terms of understanding which metadata to use and and where to store the data, there's still a lot of questions that are open. So there's a number of efforts around this. This paper by Hughes et al. Sort of go through them, and I link it there. But really, it's sort of the harmonization, the incentives, the education, the coordination. This is improving, but really the main thing is think about how will people find this? Can you store it in a certain way? Filling out the metadata is part of your effort and learning from people who deal with this to do that. Accessible. So how do I get your metadata details? That's very easy. That's part of findability. But then how do I get your data? That's part of the administrative metadata that you might do. Some are publicly available, but of course there's restrictions of all kinds depending on how the data was acquired and the expectations of the participants. And you might offer licenses that are clearly defined with certain kinds of steps, or you might request it, and then unique agreements may be created. So if it's restricted enough, you may need to request it from the researcher. For models, it's a little more complicated. They're now increasingly you might not be able to store an AI model or run it on your own devices. So some are very open and you can do that, but others you may need to get access through a programming interface, and then increasingly those are on the cloud. So there's also resource constraints. And so this is sort of an example of how this might work, of like why you do this. So you generate, sort of this identifier, a DOI, and then people are associated with the resource, but then it can be reused in lots of different scholarship. But you can also still attribute it to the original authors through this series of steps. So that's another kind of thing to think about, is are you providing the right attribution to the authors, because that helps with the incentive issue. Now for interoperability, we have a couple different things. One, for data, there's obviously many types of data of different kinds. There's many different terminologies. How do you choose? And then for models, there's different ways to produce the models, to develop them, and how do you tell people what is in this model, and how and where can it be run, or how you could work on it. So for interoperability, especially where you have a model, an AI model that wants to act on data, you can store the data increasingly in what we call common data models that have underlying terminologies that are well known and go through some kind of data quality or fitness for purpose evaluation. And the Odyssey example is what I gave. There's a standard set of models involved in that, or there's a standard set of terminologies that are frequently used. You can also now exchange data in increasingly standardized ways. And the best example of that currently is Fast Healthcare Interoperable Resources, or FHIR, which allows you to exchange information using application programming interfaces or APIs through machines to tell exactly what kind of data you want. And the combination of these standardized terminology and the information exchange really helps to advance interoperability and accessibility at the same time, which is great. And this is partially from a 2016 law called the 21st Century Cures Act, which really tried to advance interoperability in exactly these ways. For interoperable models, you may just publish the whole model, or you may sort of put it into a compiled state to make it easier, something called Dockerization. Or people are increasingly creating ways to co-create federated models. Odyssey has a software called Atlas. It does limit the kinds of models you can build, because you have to sort of agree to the model structure, but they often use open source tools underneath it that run in particular ways. Python or R are very common mechanisms for that. Still more challenging for AI because of the many, some of these models have billions of features, and just adjusting or fine-tuning the model is a whole separate thing. And so we're still, I think, learning how to do this. What has evolved pretty recently is a lot of standards for how you describe what you did, in your evaluation and development. And so there's many different kinds of AI-based standards that you can find out there to do that. And so the main thing I'd say here is, as you're developing a model, look how you're going to report on this model and find the relevant standardization for a model that you're evaluating in a randomized controlled trial. You might look at Consort AI, which is their new version. But really, to do this well, you have to look at the ecosystem. And so although FHIR is amazing, we don't have an ecosystem to, have open FHIR servers at scale that work for research yet. And so the Cumulus project was really working on this. How well do these perform? Can we create these broad bulk FHIR capabilities to share these kinds of components? And underneath that is much of the data, despite advances in requirements to make data interoperable, is still not mapped to standardized terminologies like, for instance, SNOMED, like other ones. So we still have a lot to do here. And this paper listed here goes through a number of those issues through the Cumulus project. Finally, reusable. So first, can it be reused and how can you reuse it? So this license idea for it, but you really need to publish all parts of this in addition to a manuscript, for instance. One way to really help reusability, I think, are model cards, which really go over what is this model about, what's its intentions, how is it developed, what are its limitations, what are the trade-offs, how well does it perform, what's the evaluation, and where can I access and use it? That really makes them much more reusable. So for FAIR in AI, we have a number of issues, but for CARE, what are the restrictions or thoughts we should have about sharing and engagement as we develop these, especially where data is from some historical vulnerable or community that might have suffered ongoing discrimination. And one of the things about this that's really interesting is the National Indigenous Data Sovereignty Interest Group developed a number of summaries of this, but really looking at the values of indigenous cultures and collective rights, these ideas about research and data may conflict with those ideas and may actually worsen inequities. So we sort of pull the data from the communities or resources from the communities, and then we say we're going to share them everywhere, but they might get shared in ways that are not concordant with their beliefs. And I do like to highlight here a little bit of the impact of colonization. So historically, in 1492, there were a number of countries that started going across the world and colonizing. There are very little, some islands here largely. And by 1885, there was massive amounts of colonized sections by these countries. And these countries, including the United States, did not come in and sort of coexist with indigenous people. Instead, there's a long history of taking over cultures and taking the resources that were available and using them for their own purposes. And I think that's a really important part of this, because one of the goals of CARE is to avoid really stop this legacy, think about it, and see how we could do things differently. So we do have to acknowledge, like, some of the ideas that we have here are really based in this sort of colonial idea. We're sort of taking it and we're going to put it to best use, but actually there's a lot of harm that can come from that. And an example of that, very concrete example that's fairly recent, in the 80s and 90s, up until the early aughts, was that there were a group of indigenous peoples, in this case, a particular tribe of Native Americans called the Havasupai, where the tribe themselves recognized almost half of them had diabetes. So there was such an increase in diabetes. So they approached a researcher to really understand why this is. And the researcher, Dr. Martin, at in Arizona, really sort of talked to them, worked with them a little bit, and they collected blood to then try and study it. Was there a genetic cause, for instance, of this? Now, compared to what we try and do now, the consent here was particularly problematic, but there was an agreement with the tribe that it would only be used for diabetes research. Then they took it to Arizona, and then it was used for other purposes, including schizophrenia research, which was not part of the original agreement. And so this tribe heard about this and said, this is incompatible with what we ask you to do, and also this is very incompatible with our beliefs. We don't our culture and how this should be done. And this is a particularly egregious example, but they did sue the university, and then actually the blood was returned, and this was at least stopped. Now this is a step backwards, and so what can we learn from this? Well, first of all, there's not one single cohesive group of indigenous peoples. They're very diverse, many different cultures. And so there's no sort of global thing we can say, what are all the shared values of all those cultures, but rather, how can we work together effectively? How can we collaborate in a way that respects the core components of those cultures, which is really what care is about. So the first thing is, there needs to be a collective benefit. That's a very common idea amongst many cultures, especially indigenous peoples, and to really have equitable outcomes. So often, historically, you take the researchers would come in, take the resource, and get all the benefit from the research, and then would actually sometimes worsen inequities. The other thing is authority to control. Who controls it? And in this case, the partnership, there needs to be clear authority to control amongst the indigenous people, how things are allocated, co-authorship, intellectual property and ownership. Responsibility. So thinking, what is the responsible effort here in terms of really having positive relationships throughout this, and really discussing, embodying, I guess, respect as part of that. And I will go through these in a little bit more detail. And then for ethics, there's a little bit of a difference here than some of the ethics that we might get taught as researchers. I think things are changing, but it is true that some of the training we might have gotten in research, this really is a different consideration of ethics. So really minimizing harm, maximizing benefit, thinking about justice in this broader view of justice, and also sustainability about the use for the future, which I think is increasingly important when we're considering this. So for collective benefit, I think there's been a lot of movement in here to try and think about how you collaborate. And from the start, we have to think about who we're including, and how that inclusion affects not just the individual, but the community. And so really engaging with leadership or the community in the tribe, and not just trying to get individual consent on this, which, because of sometimes information asymmetry or lack of, or that may violate directly the values of the community. And really to talk through what's the joint benefit and the potential outcomes, and trying to make the outcomes equitable. For authority control, this has evolved. This has been a nice evolution, I think, but still there's so much more to do. And I think even within Bridge to AI, there's a lot of discussion of this. So the first idea here is to avoid something like happened in Arizona. Really having indigenous controlled enclaves is, I think, a laudable goal, that not just where the the materials or the data are controlled, but also that the community, the indigenous community, has the people, the training, the workforce that can really support those enclaves to get that collective benefit. And I give some examples here, but I do think as also part of that is to really get protocols that allow that control. And there is in the Maori peoples have this data access protocol that I'll go through here. And so the sovereignty principles that they have for data have been worked into this Kaitia Katanga license. And in it, I think it really goes through what their principles are for data and what the expectations are to work with them and the data for any enclave that they might have. And also how to use it to develop your own licenses as part of this. And I think it's a lovely example. It's very easily found. Here's an example of it in terms of some of the core components from this website on New Zealand. But really thinking about knowledge and expertise, about accountability and transparency, about community relationships, not just individual relationships, thinking about all the peoples and their value, and the value that will accrue to whom, as well as a lot of expectations for groups that they work with that have culturally appropriate practices, think about community good, and are sensitive, especially amongst different groups. And so this is a really nice framework, I think, and the license really allows you to sort of work through this and think about all of this and truly partner to address the particular issue. And an example that came from this I really like, in this article called The Stupidity of AI from just over a year ago, we have to remember that many of our, especially generative AI models, are taken by basically taking information that is at least accessible somehow and appropriating it. And we've seen this in lots of different ways, but that training data, there's often not explicit permission to use. There's reasons that it's felt like by the developers they can use it, like it's publicly available on the web. But that has serious gaps in it for lots of reasons. It doesn't represent the communities necessarily. There's many biases involved, and those biases can be worsened through this. And so Tehiku Media said, well, for certain kinds of AI development, like, speech recognition system for our language, that won't be, there won't be certain kinds of robust models developed for the purpose. So that, there's lots of speech recognition models, but not for the language. And so they sort of worked themselves to create this model to get the computation needed, and then were able to actually develop a very effective model. In the process, they could then take and do translation or transcription, rather, of a large set of recordings that they had from native speakers. So that it's expanded. But the AI that's necessarily created without this kind of intentionality, I'll say, won't necessarily have that. It's a great article. If you and the article talks about this being a better way to avoid the stupidity. So responsibility. So, a core thing here is the shared responsibility. What is the responsibility of the researcher who's working with the community? What can we reasonably expect from the community? And I think here, intentionality matters, but really we have to learn about each other's values, and then we can define responsibilities. Are we adding burden? How can we advance that? And then finally, for ethics, I think this idea of the Belmont Report, 3 constructs: respect for persons, beneficence, and justice, is, in theory, very good, but how do you define each of those? Well, you can't really offer respects without collaborating, learning, understanding values, right? And beneficence is a difficult term, I think, as well, because really benefit to whom? And what are the potential risks? And this is always sort of something where we want to minimize risk and maximize benefit, but think about the different people involved. And justice, I think, is a very important concept here because, achieving, reducing inequities and historical injustices can be achieved through this. So how might we approach this? Well, many different ideas here. I think being thoughtful of it, understanding it, partnering, collaborating, really thinking how you're going to take each of these care principles and embed it in the work you do requires a lot of humility. Really think yourself about how you're going to partner, and then think about how you might adopt technology and training in terms of who has the enclave, who controls it, who understands the data and model development from the Maori example we gave, and then for advocacy, how can we expand this further so that the data mandates and regulations we have really respect the indigenous values and allow this kind of ethical respect to be really created in the world. So in summary, being fair is a laudable goal, right? We can expand the research we do, the research more reliable. We can help many more people get access to it and learn how to work with AI models. There's not just one way here, and it doesn't all have to be open, although the more open we can make it, the more likely this is to happen. But we also need to think about how we are engaging with key communities, and I've given a lot of examples from CARE, which is from indigenous communities. And we've hit on some of the major challenges related to being fair and then thinking about care that I think are being addressed, but we should be particularly thoughtful to. So I will stop there and happy to answer any questions.
There's some comments in the chat about the Native Biodata Consortium. I don't know if you have any comments about that.
Yes, I'm thrilled that we have a representative from the Native Biodata Consortium. I did not go deeply into this, but this is an example of an indigenous enclave that, we really, these are some of the ways to embed care principles. And I think, it'd be really useful to get some follow-up from them as well. And yes, thank you. There's so many great things here. Many of the references now are directly in the chat, so people could click on them and learn from them. So thank you for doing that. I think we should always put our references in the chat. If people have questions, they can type them in the chat. Happy to answer them.
Or they could also just unmute themselves and ask. Well, I'll ask one. The FAIR principles, which I think are logical to all of us, and the concerns about reproducibility. The FAIR principles kind of came about at a time when resources would get created and they would be fairly static. Now, however, we live in a world of large language models that most of us, especially on the outside of the companies that build them, are using them, but we don't know a lot of the internals. They're constantly changing. Are the FAIR principles enough for large language models that have varying amounts of accessibility and potentially changing?
Yeah, that's really interesting. So definitely, I think the concepts still are good, but how we get to sort of reusability feels very different. And for model, um, most of the principles I think require some specific reflections. So finding and accessing a generalist large language model, like many of them, it's possible, but for the fine-tuned models, for those large language models that might be good for specific studies. So if you have a protocol where you've done a bunch of prompt engineering for a large language model, I think there's a lot of missing capabilities for how you can sort of find and access that. You might be able to reproduce it in some cases more easily, but then as these evolve and adapt, it's really what we're really doing is saying, well, you might be able to reuse part of that, but things are moving so quickly that what you're really doing is a new study with similar components. But I do think there's this concern that because the large language models are so complex and not wholly accessible, right? They're held by, most of them are held by industry, not all. How do you embody that? And so I think, how do you embody those principles with those kinds of models? And I think that's still, we don't know exactly how to do that yet. I think, establishing clear protocols and be very clear about documenting what you used and how, I think that's the start. But for really robust digital interventions or new AI capabilities, we're going to have to advance the evidence that we generate, I think, as you've talked before about. And to do that, FAIR is equally important, but we've got to find some new ways to be able to do that. I think the model cards are a good start, but a lot is left out. They're clearly a start.
I have a question. Indigenous communities often have different understandings of what consent typically means than what we normally understand as consent in data collection research. So my question is there any room among the principles you've shared to include an understanding that consent should not be seen as a one-time formality, but as an ongoing process?
I mean, I think that's a core aspect. There's a couple parts of this. Is like when we talk about informed consent as trained researchers, right? We have a set of principles that it's based on, and that when our institutional review boards or other regulatory bodies that work at other institutions approve that informed consent, they're doing it from a particular perspective, largely federal law. And for Indigenous communities, that's a very different consideration for lots of reasons. I think a lot of people have been concerned about informed consent for a very long time. That, what is the shared understanding of that informed consent? And so one of the things CARE says is work, to get that shared understanding amongst the community and the researchers. Before you get started, before you attempt to have informed consent, and then build that into your process, into the consent form, but also be very clear about the limits of that use as part of that agreement, and make sure that you retain the authority to control amongst those communities as those uses expand. And I think that's a really nice, component. But I think clarity about that, and there's a lot of sort of education and discussion that is part of this. This is important for us to advance as we move forward. So I do think FAIR really wants us to be able to reuse things in an appropriate way, but we have to be thoughtful about that up front. And then I think finding better ways to retain the ability to expect, and aligning the incentives to expect to go back to for different or new uses to the communities to talk through that, and where necessary, get consent again, or change that change that process makes sense.
Thank you.
Yeah, and thanks for writing your question in the chat. There's a hand up. Oh.
Yeah, I just wanted to point out about or reinforce the idea that it seems like in the United States, consent is a legally binding contract, and it's a one and done rather than a dynamic instrument that needs to be checked on continuously over the life of the person and the life of the data of the person. I know that for the Strongheart study, they still have a stipulation that the data will be removed from the data set once the person is deceased. But generally for the NIH and the Common Rule, that rule was disposed of, I think, in 2011 or something like that. So, you know, moving towards broad consent, moving towards data permanence in a data set, even past the life of the participant is something that tribes are going to rail against, or indigenous people are going to rail against. And then the other part is the hyper individualization of consent. You know, the Belmont report and the Common Rule only recognizes individual consent, and they don't really recognize the group consent, which is the whole idea behind the Havasupai versus ASU court case, because the tribe said, no, you can't take the data from our individual members without our permission. And that's sort of the basis of the Navajo moratorium at the moment. The Navajo have a genetics moratorium for all species, including humans, and they've even threatened to go after consent given off the reservation in places like Los Angeles or San Francisco. So yeah, it's a multifactorial problem based on assumptions of the sort of Western model of or prioritization of individual rights and property.
Thank you so much, Joe. I really appreciate your comments. All right. I think maybe with that, if people don't have any questions, we'll end there. And it's a delight. I feel like whenever I think about these principles, there's so much more to learn. So just think of this as a start of a journey. Thanks.
Thank you for the delightful talk.
Great. Thanks, Dave. Bye-bye.
Thanks, Dave.